Hi, I'm Bryson Uchima. I'll be your student physical therapist today. Nice to meet you.
Nice to meet you.
Is it okay if I start off by asking you questions about your condition?
Yes.
Cool. Just to be clear, everything we talk about today will be private and be between two of us, and it'll just help me kind of guide your care, if that's okay. So, to begin, can you confirm your full name and date of birth for me?
Okay. So Taylor Brown, date of birth is 03/27/2001. I'm sorry, 1999, and I'm 24 years old.
Got you. And what sex or gender do you identify with?
He, him.
He, him. And those are your preferred pronouns?
Yeah.
What is your identified gender?
Male.
Male. Got
Sorry.
you. No problem. And is English your preferred language?
Yep.
Cool. And before we get into things, is there anything you would like me to know about your culture, your beliefs, or values that would help me better support you?
I like how you said to keep things private. I like to keep my life private.
Okay, got you. Yeah, it will definitely remain private. So, Taylor, what brings you into physical therapy today?
Yeah, so I was cutting palm trees, and I was out there for a good 2 hours cutting palm trees, and it just felt like a sharp pain in my shoulders. And so ever since then, it just hasn't gone away. It's been about like 2 weeks since that.
2 weeks. Gotcha.
It's been really aggravating.
And how would you say that kind of limits you in like your day-to-day life?
Yeah, so like around the house, it's hard to do, grab things above my head. Brushing my teeth sometimes, like getting things out of the cupboard, stuff like that. Just like getting things out, like just going overhead, really bothers
Overhead
me.
movement.
Yeah, it really bothers me.
I feel you. Okay, got you. And you said this happened when you were cutting down palm trees?
Yeah.
Was that the initial first time you felt that shoulder pain before? Have you ever felt that in the past?
I've always had like lingering pain, but it definitely got a lot worse after that day.
Yeah.
I don't know, maybe I was just holding up there for too long.
How long would you say you were going at it?
Yeah, about like 1-2 hours.
1 to 2 hours?
It was like around 2 hours. Yeah, I took a couple breaks, but it was like 2 hours in total.
Got it. So, like you mentioned before, you're cutting down palm trees, overhead tasks injure you. Is there anything else that kind of makes that shoulder pain worse?
I do work as a server, so I notice like I have to carry like to hold the cups. I have to carry 2 hands.
Yeah.
I used to be able to do it 1 hand, but the pain gets so bad I can't do it. But yeah, I would say that's pretty much my whole life. I just work, go home, and do some side jobs at home. But
got you.
Yeah.
And how would you describe the type of pain? Like, is it sharp, dull, like throbbing at all?
It's like all the above. Like
All the above.
Sometimes like when I go above my head, I get sharp pain. But if I'm just normal day in the life, it's dull pain all day long.
Dull pain.
It just kind of never goes away.
Sorry to hear about that. Can you point specifically where you feel the pain?
Yeah, just the right front area.
Right front. Do you notice it going anywhere, like traveling down your arm, maybe, at all?
Sometimes I can just like feel it down in here, but that's as far as it goes.
Got it. So you mainly feel it here, and
here to here.
Got you. Got it. And on a scale of 0 to 10, how would you rate your pain right now?
Right now, it's like 3. It's just a dull
3?
pain, like normal day in the life. It's around a 3.
And when it's at its worst, so when you're serving, you said, or doing any of those overhead, how would you describe that pain?
Yeah, definitely at work, it's the worst. I would say like it can get up to 6, 7 out of 10. At home, like brushing my teeth, those are more just like I get sharp pains. I'm not carrying something for a prolonged amount of time.
Right.
That's usually like when I do that motion, I get like sharp pain. It's around 5 out of 10.
Got it. And have you noticed any other symptoms along with this pain? Things like numbness or any tingling at all?
I wouldn't say numbness. Yeah, just sharp pains and dull.
Yeah.
Sharp and dull.
Got it. And are there any things that you're doing right now to kind of manage it? Things like ice, medication, things like that?
I do medication. I take an ibuprofen before work because I know it's gonna be painful. I
Yeah.
usually take like 200 milligrams.
200 milligrams. And how often per day would you say you take that?
So I go to work about 4 days a week. So usually I just for work. So 4 times a week.
4 times a week?
Once a day.
Once a day?
Yeah.
Got it. Is there any other medications that you're taking other than the ibuprofen to help you with that pain?
I think it's like, I can't remember how to say it. Propanol. It's like a blood pressure.
Oh yeah,
Yeah.
I got you.
I'm not good with the medical stuff, you know.
It's all good. I understand.
I just, they give it to me and I take it.
That's good.
Yeah.
So you said that was for your blood
That's
pressure?
for blood pressure. Yeah.
Mm.
I eat a lot of food.
Yeah, I
Good food,
understand.
bro.
Me too.
So,
Me
like-
too. Anyways, have you had any recent X-rays, MRIs for this shoulder? Have you seen a doctor before me for this?
No, you're the first.
I'm the first.
person to hear about it.
I'm
yeah.
honored. Cool.
Hopefully you can help me. It hurts so bad.
I'll try my
Every
best.
day. Okay.
I feel you.
Thank you.
Have you had this problem in the past before? Is this kind of the first time with this shoulder? Anything?
I
in the
mean,
past?
like this is the first time it's been this bad. You know, like I've had like aggravating pain in the past, but it's
Yeah.
never been this bad. I've always had issues.
Mhm.
Always had issues with this side.
And like cutting the palm trees, that kind of just triggered it, made it really
Yeah,
bad.
probably. Yeah.
I feel you. And have you had any other medical conditions or past surgeries that I should know about?
Yeah, no surgery.
No surgeries?
No, yeah, nothing that catches my attention. Nothing I can remember.
Mm.
Yeah, no.
And what about medical conditions?
I've had cancer in the past.
Yeah.
Had skin cancer.
Skin cancer.
Yeah, that was a while back. It was like a little while back.
Okay,
But I'm good now.
glad to hear.
Thank you.
And has anyone in your family have similar medical conditions or at risk for anything in particular? Diabetes, high blood pressure, arthritis, things like that?
I think my dad has high blood pressure, so I think that's where I get the. That's why I think I have to, take medication.
Yeah.
And my grandma, she plays golf a lot,
Mm-hmm.
and she got skin cancer actually.
Oh, I see. I'm sorry.
But
to hear
she's
about
good. They caught it. But
that.
yeah, maybe it runs in the family. I don't know. Yeah.
Sounds good.
I'm outdoors a lot, working on my
Yeah.
at my house, so maybe that's why I got skin cancer.
Got it. Can you kind of tell me about where you're living, how that's kind of set up? Like 2-story house? Do you have stairs, railings, anything like
That's
that?
a 1-story.
1-story?
Yeah, and I live by myself.
Mm-hmm.
So.
Do you have trouble, like kind of getting around the house? Has this kind of affected any of that?
No, I would just say like I said, reaching over my head.
Reaching
So if
over.
I had to get things like out of my cupboard,
Yeah.
that's where I have issues.
Got it.
That's the biggest thing right now. But if anything, anything below.
No problem. Got it. Cool.
Well, I say cooking too, because holding pots again, that can get painful.
That hurts as well.
Yeah, like when I activate, I don't know, that muscle right here,
Yeah.
it really hurts.
You said you work as a server. Are you currently in school as well, or is serving kind of your main job?
I actually do go to school right now,
Oh, you do.
part time. I'm trying to just figure it out.
Nice.
Yeah, but working part time and doing that.
Yeah. Sweet. So you're kind of managing a lot then. Has this condition kind of affected your ability to your schoolwork or your job?
Sometimes, I get stressed out, with the pain, and then I have, due dates with school,
Yeah.
so, yeah, it can get a little stressful. for
Yeah.
sure, Frustrating, stressful.
has your shoulder specifically kind of limited you to do any specific tasks for school or for work?
For school, not so much, but definitely work. I see, like I said, work is like where I have my most pain.
Yeah.
So work is like, yeah, I would say. Other than that, everything, you know, I can manage it. It's painful, like, but I've been dealing with it for, you know, for quite a bit of while now.
Mm-hmm.
Yeah, work is like the big thing.
Is there?
And, yeah.
Sorry.
And then like, you know, doing things I want to do, like do things by my house that become more of a challenge.
Yeah, of course.
Yeah.
For work specifically, what kind of tasks do you have to do? Do you have to hold dishes? I'm not too familiar.
Yeah, just holding dishes and like,
Yeah.
you know, when people, you know, leave from the table, I have to, you know, get all their plates and their cups and bring it back to the kitchen. So
Kind of like this motion, or?
yeah, now I
what's
have to
the-
do it that way. I used to be able to do it one
Do it
hand,
this way?
you know, do multiple, just do one trip, not to do multiple trips, you know,
I
because
see.
the pain's so bad I can't hold it with one hand no more.
Got you. Outside of school and your job, are there kind of like any hobbies or any like recreational things that you like to do that it's preventing you from doing?
I'm not like a sports person. Like I said, I just, you know, I'm a pretty arts and crafts kind of guy. I
Arts and
put
crafts,
things
nice.
together, you know.
Sweet.
Yeah, so that's my thing.
Maybe I gotta call you up then.
Yeah.
Yeah.
Once you fix me up.
Trade that. Okay, yeah, we can do that. And so, has your shoulder been kind of like limiting you in doing all like those handyman
Oh, yeah,
stuff?
for
Yeah.
sure. Yeah.
Mm-hmm. How would you rate kind of like your overall health today? Like excellent, good, fair, poor?
I say good.
Yeah.
Like, you know, I have a lot on my plate right now, so
Mm-hmm.
let's say good.
And do you smoke, drink alcohol, or use any other substances?
I just drink, you know, just going out with the boys,
Yeah.
get a couple of drinks.
Yeah, of course. And how often would you say, and how many drinks?
Maybe once a week.
Once a
like on a
week.
weekend.
Okay.
Once a week.
Are you getting good sleep every night? About how many hours?
Yeah, I wouldn't say I'm getting the best of sleep.
Mm-hmm.
5-4 hours sometimes.
Yeah.
You know, it's just working and going to school and a lot of stress sometimes.
Yeah, I bet. Would you say your kind of physical activity level went down after the injury, or stayed the same, or describe kind of your physical activity levels?
I would say it's about the same, but it's just more pain.
Mm.
So that's sometimes, yeah, I would say it decreased a little bit because of the pain.
Yeah, okay. And doing school and jobs and stuff, you said that kind of comes with a lot of stress.
Yeah,
Yeah.
for sure, yeah.
And has that stress kind of affected like anything sleep-wise, or just your overall health in general?
I would say I'm pretty healthy in general.
Yeah.
Just typical stress, you know, but I'm able to manage it, I feel like.
Get that? Yeah. Have you experienced any unexplained weight loss, fever, night sweats, like anything like that?
No.
No?
No.
That's good. Any abnormal sensations like numbness, tingling, loss of coordination, anything like that?
No.
Okay, cool. And by the time you're finished with physical therapies after all our sessions, what kind of activities would you like to get back to doing again? Handyman stuff as well? Or?
Yeah, you know, just doing stuff around my house again. You
Yeah.
know, there's some projects I want to start, not able to start those right now because of my pain.
Yeah.
And then just being pain-free at work, honestly, that's where I have most of my issues.
Mm-hmm.
So I would say those are the two biggest things I'm trying to get back to.
Got it. And what's kind of, how soon would you kind of like to get back to that?
Yeah, I mean, this project I'm trying to get done before, you know, my parents come to town, which is about a month.
A month?
I think it's 4 or 5 weeks. So hopefully, you know,
Okay.
I can get started with that soon.
We'll try our best. All right, Taylor. Just to summarize everything, you're coming in because of your right shoulder pain. It's kind of limited you, like handyman task-wise, like things at home, but as well as serving your job, your occupation, that kind of brings a lot of pain. And you said it's pretty localized in this one area, doesn't, oh, it radiates down a little? you
Just
said?
to the, like bias stem, is that?
Yeah,
part
around,
of
yeah,
my-
yeah,
yeah,
so
that-
it does radiate down a little
Yeah,
bit, okay.
but it doesn't go any further.
Yeah, okay, cool, and you kind of want to get back to your normal function within a month, 4 to 5 weeks, you said?
Yeah, hopefully, so I can,
Hopefully.
start that project before my parents.
All right, sweet. Well, that's all the questions I have for you today before we begin our range of motion assessment, but I'd like to thank you for answering all my
Thank
questions.
you, I appreciate it, Doc.
And let's get started.